Welcome to another episode of Judgment Date. I thought that perhaps we would have ended the series by now, in that I had done all of these programs because of COVID, and you were all locked down, and we were all anxious about the virus. And then all of a sudden, after the third wave, the virus went away for a while, and everybody started to think we were back to level of normality. Well, unfortunately, we aren't. And now we've got this Omicron variant, which has created huge levels of anxiety, and more than just anxiety. And so I thought it'd be good to resurrect the program again because of the anxieties of people, and to be helpful to them to get some intelligent expert advice. And there's nobody better to give us intelligent expert advice than Professor Francois from Wits University. Francois, again, thank you so much. You've been absolutely wonderful in explaining stuff to the public. I mean, there's so many questions to ask you, but I suppose the first is, when I interviewed you some while ago, you once said to me, we will get different variants, but you said Delta is such an unbelievably infectious variant that it's hard to think as a virologist how you'd get a worse one. Well, we have got a worse. Is it a worse one? I mean, I suppose, what is the reality about this vaccine, about this variant?
So, with all the usual caveats, I can get this wrong, and I got that one wrong. It looks like it's much more infectious. It spreads like a demon. I cannot believe how quickly it's just carved its way through Gauteng. Amongst my staff, my friendship circle, it really is phenomenal how quickly it's just spread. And those kind of old things we had last year, 1.5 meters for more than 15 minutes thing, just out the window. This thing just spreads from one person to the next, like nothing on earth. Whether it causes more harm is anybody's guess at this point. So when people say, oh, it's milder, it's in the context of a huge number of people having been infected with COVID before. So they've got some immunity, and a chunk of the population, probably about a third, have been vaccinated. So in the context of most of us having some immunity, you, me, having been vaccinated, many of us having had COVID, Omicron does seem to have a very muted effect. And my friends who are in the hospitals, and it's quite an interesting phrase they keep saying, this feels different to Delta, to what happened in June. When Delta came along, it was catastrophic. It hit the hospitals. It felt overwhelming, exactly like it did in June a year ago, exactly like it felt in December. This one just feels at the moment less severe, and that feels good. But that is also in the context of most of the population being immune. There is an increase in the hospital beds going up. There is a sense that people are getting sick, that seems to be in people who are unvaccinated, and presumably people who have never got the infection in the first place, people who had no immunity to the virus in the first place. So I think what we're dealing with at the end of the day, and this is my guess, talking to much smarter people than me, people like you've interviewed before, Shabir, and people like that, is we're dealing with something that is more infectious, that may be just every bit as nasty as the previous, but it's dealing with the population whose immune system is just that much more smart. So it's the tester is what we're dealing with.
Let me ask you this. I mean, I heard you on the radio the other day, and it brought a chuckle in this awfully gloomy thing when you said it's totally doff to be inside with a whole group of people under the situation. But what are you telling me? Even outside, you can catch it?
Look, I think you'd really have to be in a rugby scrum situation, or sitting around on a picnic blanket, skulking underneath an umbrella right next to each other and coughing on each other to really get it. Still outside doors is so safe. You'd be hella.
Majority of people are getting it indoors, I take it.
Absolutely, overwhelmingly indoors. Indoors is where it's at. Being on a beach, even when I saw a kerfuffle yesterday about Durban beachfronts and people, being crowded, you really have to be unbelievably unlucky to catch it on the beach. Between the sun, the wind, and being outdoors, that's not where you're going to get it.
If I could then ask you as well, I mean, there was a debate just this week, or let me say webinar between Discovery and Medical Research, obviously. So as I understand it, unpacking this, if you've had 2 Pfizers, then they're saying roughly you've got a no more than about 30% protection rate. What does that really mean what does that mean? Does that mean that 3 out of 10 don't get it and 7 out of 10 do? Or what does that mean for ordinary people?
I was trying to also do the same thing, trying to dissect that data out. It's quite ugly data. And yeah, I admire Discovery because they make their data available, which lots of other people don't. The problem is they don't publish it, so you can't get the real nerdy stuff, like where you can go down into granular detail and unpack what it actually means. And we need to be able to do that. And kudos for them for releasing it, but they need to give it the real deep data so that we can really sort of unpack it, get the smart people to really look deep dive and find out what that actually means. I don't quite understand what they mean by 30% of people get it. The thing about the COVID virus, and particularly with Omicron, is we need to make our peace. Again, Shabir explained it to me really interestingly. He said, we must stop talking about immune evasion. We must talk about antibody evasion. Antibodies are like your stupid sentinels. They're the dumb guard at the front door, which just stops the virus from getting absolutely through. And those antibodies disappear quite quickly. After vaccination or after infection, they disappear after a few weeks, and you will get infected. What the T cells, which everyone's now familiar with, stop is the invasion phase. That's the thing that puts you in hospital and kills you in the vast majority of cases. So this thing doesn't stop you getting infected. The vaccines don't stop you getting infected. Infection doesn't stop you getting infected. The vaccines and infection stop the invasion phase. And this is where the noise of infection versus invasion gets messy. And when people say the Pfizer doesn't work, you have to ask them is, do you mean infection or do you mean putting you in hospital? Because the thing I take from Omicron and from the variants is that the vaccines, all of them, work brilliantly against all the variants, including against Omicron. And people do not go to hospital. And if we survive this December without massive hospitalization, what I'm going to walk away with is the reassurance is that I'm protected with the current vaccinations and that we can finally relax a lot more. And that includes people who are vulnerable. We can stop living in fear.
But can I ask you this on that? My understanding as well is that if one or many countries are talking about boosters, so I take it that what your colleagues are saying is if you've had two and you get a third one, that's going to give you what? Enhanced T cells. I don't know what the technical expression is, but
that's pretty good actually.
a higher level of protection than you've got already.
So instead of 92, you'll go to 95, percent, whatever that means.
If we've got, as I understand it, millions of vaccines which aren't being used, surely we should try to be opening us up to giving people a booster. So why aren't we? Why are we so mingy about this?
Your and my guess is as good. I just feel like government's trying to control this thing so much. They're so focused on registration rather than on access. And what they should be doing is saying to everyone, we've got mountains of Pfizer at the moment, which are about to expire. Just get them out there. Like, stop trying to control this whole process. If people want to get a third, and if they really want to get a fourth, just knock yourself out, go and get these things. We know that boosting makes immunological sense. We haven't got perfect data on whether it makes clinical sense. But if you've got boosters available, let's get them out there. Don't let them expire. That's a complete waste. We know these things are really, really safe.
Can I just ask you from a layperson, what's the difference between immunological and clinical?
So immunological is just like we can tell that your immune system is like super boosted. So we give you the vaccine and bang, your immunoglobulins go up. We can just take the blood test and we can say, oh, it went from like 3 to 30. Clinical means that we can actually tell that you're less likely to end up in a hospital bed. So it's quite hard to do those studies because the vaccines are so good that to measure a hospital bed impact, you have to test it on like sometimes 100,000 people. While doing a blood test, you pretty much need to do it on 5 people. And that's much cheaper and easier for the drug company to do, which is why you often see the drug companies parading these results out literally within days of Omicron coming out. The drug companies could do those kind of tests very, very, very easily.
Can I just ask as well, from the science community's point of view, the discovery discussions, or what they've told us? I mean, when I interviewed Shabir Mardi, he said it's not surprising that there's been increasing breakthrough infections, because he took the view, as I understood it, that, as you just said, this is more infectious. He did. When I said, well, when will we know what sort of levels of protection? He sort of suggested, like you have, that it's likely, because you can make scientific inferences, that this is protecting people. But are we a long way away from sort of getting a definitive study which says that's where we are?
So look, every passing day, the data sets just get better and better and better. And, the beauty of Omicron is it's red list or no red list, it went everywhere and it is tearing its way through the entire world. So everybody who has a better data system than us is busy populating that like nobody's business. And within the next 3 or 4 weeks, we will have as much data as we need to be able to sign off on Omicron and say it is as good as it gets. The problem with South Africa, good problem, bad problem with South Africa is that our population is relatively young. So seeing the impact on older populations is harder it just takes a little bit longer to tell. But the thing is tearing its way through the UK at the moment. So we will know the impact on older populations very, very quickly. And there's still a significant number of people unvaccinated there. And they haven't had as many people infected as in South Africa. So we will tell very quickly on what happens to unvaccinated, older, vulnerable populations there. And they obviously also have far more comorbid conditions.
But
so probably in the next week or two, we'll know.
Okay. And people listening to this, and I hope many will, the real take-home point is you've got to get vaccinated because that is going to give you a far greater fighting chance.
And I think everything we can tell, so amongst my staff, for instance, 3 or 4 of them have had it twice, and one of them has had it 3 times. She was actually vaccinated twice. She was in the original clinical trial, and she was vaccinated through the Sasonke boosting program. Each one of them, with each subsequent infection, have had a much more mild experience with the infection. So it's exactly what we would predict. And Shabira would just shrug his shoulders and say, yeah, I told you so, which is that your immune system is just primed. So the bug is actually behaving as a booster each time along with the vaccine. And you're just shrugging it off. And that's essentially what all the coronaviruses do that we've had since we were kids. Every time you get it, it's just a little bit milder each time round. So it is very heartening.
Are we going to, I mean, I assume that the pharmaceutical companies are going to produce something else, or will that depend on the data? I mean, if the data shows that a booster kind of does the job, then you don't really need to worry so much about another vaccine, a different kind of vaccine.
Look, they want to flog as many vaccines as
possible.
Of course. And the terrible thing about this is there's no incentive for them to work together. Like Pfizer will sell more Pfizer and J&J will sell more J&J. They won't work across. So unfortunately, we kind of forced to work to try and just tell from data sets what to do. From what we can tell, using different kinds of vaccines gives you broader immunity, but even using the same one works pretty well. There is a world where we actually don't need to use more than what we've got, particularly in younger populations. I think most of us think you probably are, particularly in more vulnerable populations, older populations, people with diabetes, all the usual suspects, probably would benefit from a booster. And because the side effect profile is so small, that kind of gambling on that, saying, listen, probability is good for you, side effect profile so low, let's just take the vaccination for that reason, is probably where it's going to weigh down. But that's why these mass boosting programs happening in rich countries at the moment. And also why we're saying you've got this mountain of Pfizer sitting there, at least give it to the older populations, give it to people who are immunosuppressed, who have these, have comorbid conditions. Just gamble on that. We understand we've got pretty good data to suggest that giving a booster gives you a little bit more protection than the original 2 vaccines that you've had.
Would that both be for being infected and for hospitalization?
Both, yes. Look, giving the vaccination gives you protection from infection just for a few weeks, pretty much, or maybe for 2 or 3 months. But none of us wants to be in bed for 2 or 3 days anyway, and that's pretty much what it protects you from. So for all those reasons, it seems a good thing to give the booster.
And just on that, you mentioned children. I mean, this issue of that you're seeing more younger people getting this or being hospitalized, is the data showing that it's affecting the younger population worse, or just because they weren't vaccinated?
I've got much less of a handle on that data set. And my sense is that even amongst pediatricians, they don't have a good handle on that. Pediatricians have a much lower threshold for admitting people to hospital, for admitting kids to hospital. So when they came out and said, oh, all these kids in the hospital, that might just be the pediatrician saying, listen, kids die much faster than adults do. So they put them in hospital that much easier. So that doesn't in and of itself mean it's more severe. I think that's the kind of data set we're going to be unpacking over the next few weeks to work out what's going on there. And again, we'll find that out from rich countries because Omicron is going to do that to the childhood populations. I think the debate around vaccinating children is steadily falling on the side of vaccinating children. We do know that children get much less severe disease, but they still do occasionally get severe disease. And then we're starting to factor in things like long COVID, and we know kids also get long COVID. They're much less likely than adults, but it's still something to factor in. So kids get hurt by COVID, less so than adults, but they still do. So that metric of weighing vaccine and COVID starts becoming something we still need to apply to kids.
Could I then just move to something else you said? You used the word tearing through the population, and it's perfectly obvious that that is occurring. I mean, stunning levels of numbers. But it did, I mean, maybe this is too early to tell, but is it possible that the wave will be more violent but shorter?
Absolutely. I mean, if you look at Gauteng, it's been almost metronomic, the 6 monthly waves have gone through. But each wave has got steadily more and more narrow. And what's beautiful in Gauteng is almost the upswing has been exactly the same as the downswing. There have been some predictions, in fact, that Gauteng might peaked last week already. Now we'll find out in the next week or two when that peak actually happened. It's clearly peaking in the Western Cape. The numbers are screaming up in KwaZulu-Natal at the moment, and all the other provinces are reporting cases. So we will find out very, very quickly. They can tell in the labs. I've got all these nifty ways of telling, but all my lab nerd friends who are sitting looking at CT thresholds and the way they tell these things, they are actually telling me that the CT thresholds are going up, which is a very early sign that in fact it is coming down in Gauteng. So with a little bit of luck, we're already on the tail end of the Omicron wave in Gauteng.
Interrupt you, but it did seem to me, just as a complete layperson looking at the numbers, and I wanted to ask you about that because the numbers seem to be also all over the show. But if I'll come back to the accuracy in a moment. But Gauteng's been sort of hovering around about the 8,000 mark now for quite a number of days, after having gone from literally 0 to 8,000 within a nanosecond.
It's ask you, remarkable.
Are the numbers? I mean, what is this? It seems to me that the NICD are not being as reliable as they should be, or is that not correct?
Oh no, I don't think it was that. Actually, I think it was just a whole of IT people gravitating between systems by the sounds of it and not dumping the data. And it's as simple as that. I know a lot of the NICD people, and they're completely transparent. I think they're as horrified as anyone else. Issuing that Sunday night apology was quite heartbreaking to watch them. I really think what's actually happening in Gauteng is so many people are diagnosing themselves at home. These antigen tests are just taking off. So I actually don't even look at those numbers anymore because I just think that people are not reporting the testing numbers at all. Pretty much 3/4 of the people I know who've been tested are just doing home antigen testing, are not doing PCR testing anymore. So those are not being picked up anymore. So that absolute number of tests are probably not particularly useful anymore going forward. So we're probably going to have to find better ways of picking up these waves. These wastewater things are really clever though. They seem to be the way going forward internationally, is that, and in fact in South Africa, that was the first early indication that we were seeing an early part of a wave. So these nifty other ways we're probably going to have to rely on going forward in the future.
So when your colleagues tell you through various methods that it's possible that Gauteng is reaching its peak, it's not that they're relying on NICD figures, because for what I gather, I shouldn't be particular. Those figures aren't accurate because people are doing their tests at home. Is that what you're saying?
Yeah, absolutely. I tend to triangulate. When my staff tell me they're positive and NICD tell me there's positivity rates and the wastewater people tell me they're positive and my friends in the ward say, I'm seeing a few extra cases, all of those things coming together at once, I tend to say, oh dear, we're in a wave. So, and that's exactly what happened here. It's exactly what happened in Delta. It actually happened in December last year. It all came together at once, and as I said, kind of triangulated together and came to pass. This was the wave in Gauteng. So I think
should we be making the antigen test sort of almost free for people so they can do it themselves?
Absolutely. I think that this test is it's not as reliable as the PCR in terms of its positivity rate, but the PCR test it's incredibly expensive. I see the prices come down, but it's fiddly. It tends to stay positive for ages. It's very uncomfortable. The antigen test is really, it's not quite as sensitive. It can be negative, but it's so much cheaper and so much easier to do. I did it on myself 2 days because I was feeling vaguely out of sorts. And honestly, it takes 15 minutes at the most, and you can just do it. And rather do 2 or 3 of those in a week at a fraction of the cost. And you can do it at home, and we really should be pushing harder to have that available.
And that would be a government initiative. They could do that.
Yeah, or you could just make it available at a subsidized cost. They still, I mean, they're a bit fiddly, but honestly, we're busy doing evaluations at my unit. One of my colleagues, Mohammed Majam, does all these things, and he tests them on me because I'm absolutely useless at doing them. And the first time you do it, it's a bit fiddly, but the second time you can do it in your sleep. They really are so easy to do. And they're relatively cheap. They cost 22 or 30 Rand. So if you're going to go and visit your granny and you're a bit worried about it, then just do the test, and if you're feeling a bit out of sorts, you can do the test and check that you're positive. So they really do we just need to do it. And internationally, that's how they're being used, is if you're going into a high-risk situation, if you're a healthcare worker going into an old age home, you can do the test 2 or 3 times a week. You just swab the back of your nose. It's much more comfortable than the PCR test.
If you did this on a widespread scale and people were responsible, that is, they took the test and then they could see they were positive and they isolated themselves, you've got less of transmission then, because you don't have people wandering around with this thing as much.
The problem in a place like Gauteng, where most of the infections are actually asymptomatic, it probably is not going to do very much for stopping transmission. Where it's an issue is if you're going into a very high-risk situation. If you're going to go and visit somebody who's immunosuppressed, we are very worried. Perhaps that is where you might want to take some extra care.
Gotcha.
Like I was going to, an end-of-year party. There, it's probably not. Rather just have the thing outdoors and anticipate that 2 or 3 of the people are going to be positive. So just be thoughtful about the context rather. But say you are visiting somebody who's very vulnerable, a granny that you really are worried about, then maybe that's where the test has a place. But these are the kind of things we need to be starting to think about as a society. And those tests, I think, are really useful.
So, excuse me, one final question, because I'm running out of time. In the light of what you said, and in the light of the fact that I understand that the government's pondering what to do next, if you were the Minister of Health of the President, what additional restrictions, if any, would you be imposing in the light of what you just told us?
I really don't think there's any room for restrictions. I think you need to be supporting the society. I think just throw every resource you can at vaccinating the country. I just think that's the way forward. I think educate people about the indoor stuff, masks are the kind of way to protect your indoors when you can't get away from people, but that's pretty much it. There's no role for any lockdowns. These curfews are silly. All the restrictions are just a distraction. It's just theater to my mind. And just rein in your politicians. I can't believe the things that come out of politicians' mouths in the last month from every single party. I just can't believe the stuff they say. I just want to herd them all into a room with open windows and doors and masks, but just give them the sort of vaccine 101. Just like, this is the simple stuff. Like, can't you be a little bit more responsible about this stuff? So I just don't see anything about restrictions. Just no real point to it anymore.
So that leads me to one final question. The reason I'm doing this interview is precisely because of this question I'm going to ask you. Hasn't our education been pretty pathetic in relation to actually educating not just the politicians, but the public? I mean, isn't part of the bloody anti-vaccination advantage to them is because they seem to be able to trot out their rubbish far better than we should be trotting out the science?
Absolutely. And I don't think it's that hard. I think that they should have got a whole of proper communication experts in, got some key opinion leaders and put the stuff forward. Like get the people who market Coca-Cola, I guess, to do this stuff. What you don't get is a whole of middle-aged, Ponzi medical people to come and do the messaging. We're not the people to do this stuff. It's not what we're trained to do. Like get people who are actually experts in that, get the messages through, and then get your politicians on board. Clap them over the wrists when they get it wrong. Don't allow this stuff to continue. And yeah, that's the kind of thing I think that they've really got wrong. The vaccination program is really the way out of this thing. And if we write about Omicron, that it turns out that our immune system can do the trick, that is what is South Africa's way out of this horror show. And I'm hoping that Gauteng at the moment, in 3 weeks' time, that we'll turn around and say that was the global test case that our immune system allowed us to get past this, and that we can all start exhaling over next year.
Well, from your mouth to God's ears on that, although I suppose for a scientist, I shouldn't be saying that. The science should tell us. This has been a really, I hope for everybody, a sort of educative experience, because it certainly has been for me. As Professor Venter has said, it seems to me one of the most terrible tragedies of all of this, apart from all these deaths and illness that have engulfed us, is our inability to communicate to the population at large precisely what's going on in words that they understand. I hope that this particularly clear exposition by Professor Venter has helped to do this. We'll be having more programs of this kind. Francois, as always, I'm incredibly indebted to you, as I'm sure the country is, for all the work that you people are doing. Thank you so much.
Take care, everybody. Thank you so much.
You take care.